So imagine this, you're involved in a serious vehicle accident, it's a rollover, and a bystander called 911. The ambulance responds, they get on scene quickly, and you think you're good, right? You're thankful you're still alive, but you're still losing blood extremely fast. Use your imagination, but you're bleeding. So every minute without treatment actually decreases your chances of survival. So I know you're thinking the paramedic can just slap a tourniquet on and give you some normal saline to replace that volume. It should be that simple, right? Well, the National Highway Traffic Safety Administration states that severe blood loss, which is also referred to as hemorrhage, is one of the leading causes of death in traumatic injuries. So as a paramedic, I have taken care of multiple patients with life-threatening blood loss, and 99% of the time, all I can do is load and go because they need blood products. So according to Matthew Levy in the Journal of American College of Emergency Physicians 1, he states administering blood before the patient arrives to the hospital provides earlier definitive treatment with severe blood loss. So today I will inform you on pre-hospital blood administration in emergency medical services. So in my speech, I will explain what pre-hospital blood administration is, when it is used, and how it improves patient outcomes with hemorrhagic shock or severe blood loss. So pre-hospital blood administration allows EMS providers to deliver definitive care on scene. So this is going to be them replacing the blood loss in the ambulance, helicopter, before the patients even arrive to the hospital. Rowland explains in the article Red Blood Cells that that blood contains hemoglobin, and hemoglobin carries oxygen, which then is delivered to the rest of the body, which perfuses you. So in another article titled Shock, O'Neill and Webb-Bull explained that hemorrhagic shock is hemorrhagic shock is when your vital organs are no longer being perfused, leading to organ failure. McNeely explains in the JACEP Open that blood administration is the preferred method of resuscitation in hemorrhagic shock because of the oxygen carrying capabilities and the replaced blood clotting factors. So now that we got a little A&P lesson, we can now know more about blood and blood administration. And that leads me to my next question, which is, when does EMS need to use it? So pre-hospital blood administration is used in patients who have severe blood loss. This can be in traumatic injuries or medical conditions. So according to Levy, patients with life-threatening blood loss benefit most when they receive blood products within the first 35 minutes of injury. In the Scandinavian Journal of Trauma, Resuscitation, and Emergency Medicine, Kadokith explains that patients experiencing medical emergencies associated with blood loss also benefit from pre-hospital blood administration. So this could be GI bleeds, this could be postpartum hemorrhage, or AAAs, just to name a few. The National Highway Traffic Safety Administration also explains that many EMS services that do carry whole blood or blood products allow patients to receive definitive care sooner. EMS can act faster at stabilizing patients by bringing the blood product straight to the scene and administering it while en route to the hospital. Every minute of delay of getting pre-hospital blood, or just like your blood products, increases the risk of mortality by 11%. So now that we have gone over pre-hospital blood administration, what it is used for, when we use it, we can now talk about how it significantly improves patient outcomes. So pre-hospital blood administration improves the patient outcomes by providing the earlier definitive care. So Clark reports in Military Medicine that blood products are the preferred method of resuscitation in the field because it does allow the providers to bring the definitive treatment straight to the patient while also replacing their oxygen carrying capability and replacing the circulating blood volume. In the Journal of Clinical Medicine, Kimlick reports that excessive crystallide use or your IV fluids can actually dilute pre-existing clotting factors, which can actually worsen bleeding. According to Levy, Kadoketh, and Kimlick, early blood administration improves patient outcomes by increasing the patient survival in hemorrhagic shock. So in conclusion, today I informed you about pre-hospital blood administration, what it is, when it's used, and how it improves patient outcomes. The National Highway Traffic Safety Administration states that EMS services that administer blood products in the field can deliver faster, life-saving treatment sooner, giving the patients a better chance of survival. So the next time you see an ambulance or a helicopter, just remember that they are not slapping on a tourniquet and they are not just loading going. They are actually delivering definitive care to these patients experiencing extreme blood loss. Any questions?